Hey there, welcome back to EMS Abounds and Do Your Job. So 1 to 5 minute videos on doing what we're supposed to do. My first video was on basics first, BLS first. All right, doesn't matter whether you're AEMT, EMT, or paramedic. Do the basics first and do them well. Today we're going to pick on the medics a little bit, and this one is IV pumps. I've seen a lot of medics who refuse to use their IV pumps. They might use them on a transfer, literally, well, I'll take your pump, it'll be easier and quicker that way, right? Or they might set theirs up to run heparin. Well, how many mLs do you have? They don't really know how to use the pump, they don't know how to set it up. And a lot of medics won't use it on 911 calls. You know, cardizem, nitro, lidocaine, dopamine levophed, right? Well, we don't need it for dopamine, and we don't need it for lidocaine, so why bother? So you get better at it, and it's more efficient and more effective. I tried to say that together. Cardizem, great example. We give point whatever per kilo. I'm going to do a video on cardizem specifically, but so let's say you give 15 of cardizem IV, diltiazem, and you're supposed to do a 5 milligram an hour drip afterwards. People go, well, I'll just rebolus them if I have to. That's not the right way to do it. The idea with a bolus is to get your blood levels to this point where it's effective, right? And then a maintenance infusion keeps it that way, roughly. You might have to increase it a little bit. You might have to decrease it a little bit. But by bolusing, especially with, say, cardizem, we get it to this level where the rate starts to slow down and we're kind of happy with it. And we start our 5 drip and our rate stays at 90 or 100. Perfect. But if you rebolus them, now the blood level climbs, bioavailability is greater, and now their heart rate tanks. Okay? You can't take cardizem away. You can always give a little more. Let's say with nitro, right? We give them, we'll just give them sublingual nitros. We don't need a drip. We're only 20 minutes from the hospital. So your bioavailability does this. Okay? Your vasodilation and your blood pressure, oppositely, does this. Okay? It's not a very stable or safe way to do drugs as a provider. You don't see lazy ER nurses, right? They use pumps all the time, and that's the trick to this, is use your pump whenever you can. I was EMS educator for a service, and I had the same problem, and this was just medics. We ran a double medic intercept truck, and they didn't want to use pumps. And what we did was every day when crews came in, we had a pump and fluids out for them so they could prime the tubing, right? Because some of the pumps we use, like the Alaris or Metal Arms, whatever it's called now, is very finicky with that air bubble in that cassette. So every day you come in for your shift, you prime a tube. You know, you prime a pump tubing, and then you put it in, and you go to your library, you pick nitroglycerin today, and you want it at 40, you set it to 40, okay? And then you play with that. Oh, I want to titrate up to 50 mics a minute, or I want to titrate down to 30, okay? And the next day you come in, you do it again, and you go to diltiazem, okay? And we also made it so that if you were transporting somebody, and we had 20 to 45 minute transport times, if you wanted to give a bolus of fluid, I'm giving a liter of fluid. It's not emergent. They're stable. They're a little dehydrated. Put it on the pump. Run it at $9.99 an hour. Okay, and it gets you used to that pump. Okay, it's all about safety. It's all about consistent drug delivery for our patients. They feel better if you get them to here and keep them here. Okay, think about if it was you and you had a kidney stone, right? Would you want your pain doing this? Same thing with chest pain. Do you want your pain doing that? The difference is with a kidney stone, you just feel like crap and you're puking when the pain's back, okay, and when it's bad. With coronary artery disease and angina or whatever it might be, that pain up, pain down, pain up, pain down increases stress, increases sympathetic response, increases myocardial O2 demand, pain climbs again, okay? So up and safe. Most of our drugs, that maintenance infusion is the safest way to do it. You've got this. And if the pressure drops a little bit, you can do that with it versus rebolusing and drop, rebolus and drop. Okay? Don't be scared of our pumps. Use them so that you know what you're doing with them and you'll feel confident with them. And don't be lazy. Right? It's about our patient. Would you want your mother having this done? Or would you want your mother having that done? Okay? And just treat all your patients that way. Learn the pump you have. Learn the library in them. And keep in mind that the library that's programmed into them is probably far more extensive than the drugs you're using. And the concentrations can be different. You know, this week, Memorial's Pharmacy bought lidocaine that's 4 per ml. Next week it's 8. The week after, it's just what's available, okay? So please make sure that you read the bag, you double check your library, you put the correct concentration in. Just get comfortable with it, okay? If you happen to live in a state where, you know, they're not using pumps on 911 calls, that's a fight you should fight, okay? Because again, it's about safety, bioavailability, making our patients healthy and happy, okay? Thank you. Take care. Be safe.